So again, we're going to read the med board to you. Navy Medical Center, Portsmouth, Virginia. Addendum to report of medical board. From medical boards, Naval Medical Center, Portsmouth, Virginia, 23708. 2. Central Physical Evaluation Board, Naval Council of Personnel Boards, Arlington, Virginia, 22203. Commanding Officer, Naval Medical Center, Portsmouth, Virginia, 23708. Subject, S.A. Shane E. Lee, USNSSN. I will skip that. Addendum to report of medical board, 1 December 93. The patient is a 24-year-old active duty member who fell 3 stories onto the pavement the day of admission. The patient landed feet first and fell onto his left side. He was admitted and cleared by general surgery for his abdomen and cervical spine. He was admitted to the orthopedic service with a complaint of sacral and low back pain. The patient was diagnosed with X-ray and physical examination to have a vertical shear component complex pelvis fracture with elevation of the left hemipelvis approximately 0.5 centimeters to 1 centimeter. The patient also had a large pelvic intraperitoneal hematoma, which was stable. Is that internal bleeding? I guess, I don't know. The patient was taken to the operating room the day of admission, where he underwent closed reduction and placement of external fixation device on his pelvis. Post-operative X-rays confirmed maintenance of his reduction. He was admitted to the ward where he was kept in a skeletal traction. It was noted during the operation that the patient also had a left talar dome fracture and lateral ligament disposition. The patient had an arthrotomy performed. Aeration and debridement of the ankle joint and primary closure. The patient was placed onto a short leg cast post-operatively once the swelling went down, and the splint was removed, right? The patient was kept in skeletal traction for approximately 4 weeks, and the traction was discharged after x-rays were taken, right? 1 week post removal of the traction, the x-rays were retaken and showed that there was minimal increase in the change in the elevation of the pelvis, right? So that means I'm now a centimeter shorter on one side. Good thing you can laugh about that. The patient was undergoing bed-to-chair transfers, and at the point that the x-rays were noted to be stable, he was progressing to toe touch only physical therapy only weight bearing on the left side. The patient had done well in physical therapy with toe touch weight bearing, and it is planned for him to be advanced to removal of the external fixation device, right, at the 6 to 8 week point post-operatively. The patient will be taken out of this short leg cast at the 6 week point as well, and placed into a gel splint to allow range of motion exercises and still maintain support to the collateral ligaments. Diagnosis: complex pelvis fracture with vertical shears, component of the left hemipelvis. Number 8088. Grade 3 ankle sprain with osteochondra defect of the talar dome. 84500 and 7288. It is the opinion of the medical board that the patient is medical condition interferes with the reasonable performance of assigned duties, right? On that basis, this case is referred to the physical evaluation board for further fitness for duty, right, determination, right? It is recommended that pending disposition that the patient continue with his inpatient care and progress towards outpatient care, which he will be able to continue therein the VA system. and Brian Heron, L. DXMC, something like that, USNR, right, and Martin K. Deffern, Brace, Captain MC, USN, right. I have read the contents of this addendum, and I do not desire to submit a statement in rebuttal, right? I don't know nothing about it. In other words, right? Shane E. Lee, witness Sidney Thoreau, 11/3/94, right? First endorsement from Commanding Officer, Naval Medical Center, Portsmouth, Virginia, 23708, to Central Physical Evaluation Board, Naval Council of Personnel Boards, Arlington, Virginia, 22203. Forward, K. Bukta, or Bukta, by direction, D. October 24th, 1994, T. October 24th, 1994, D. PJH 3886 3732, right. Shane E. Lee, SSN, page 2. Sorry. So, like I said, right, page 1, of course, and then the same thing at the bottom. So, these are documents you can't deny now. So, you're denying it now, right? So, you're the schizophrenic. And it's not supposed to be something you catch. It's something you develop when you're either under a lot of stress mentally, or someone's causing you stress mentally, right? And that's not, imagine if you can't do your job and you don't know what you're supposed to do and no one will show you, right? That has nothing to do with paranoid schizophrenia, right? And for you to assume someone who never worked on shipboard equipment to know what to do, that's crazy, Navy, right? They weren't even showing me the piece of equipment they wanted me to work on, right? Like I'm supposed to know that, right? Or just give me a work card which had typed information but didn't show me what I was working on either. Does that sound familiar if you're in the Navy and you're an electrician? Am I missing something that my shipmates were supposed to show me but didn't show me? Does a book go along with it or something? Well, they didn't even really tell me that. They did show me a bunch of books on the shelf, but I didn't see them using them either. Right. That's the problem. I don't know what the hell they're doing. I know. I'm not a shipboard trained electrician, just went to A school, that's it. But I wired my little fan up there nicely, right? Still works. I know that. Keep showing them that too, right? I did learn something from you, Navy. But I can't use it because of a bad ankle and a bad back, right? Uh-oh.